The number one health problem in Africa in general is, of course, access to medicines, malaria nets. But the major problem is the delivery of them. It makes it difficult for the nurses and the doctors to see patients. And for the patients, they have to walk miles or use bicycles.
They often have to carry their children, their sick ones, their loved ones. Oftentimes, the way that people deal with health crises is not do anything.
If you have cold vaccines and a doctor, but you have no way of getting that doctor and the cold vaccines to a rural village where they're needed, that's a big problem.
This was a research funded by the Bill and Melinda Gates Foundation on the effectiveness of motorcycle transport in the delivery of healthcare in remote areas in sub-Saharan Africa. A joint project between the Stanford Business School and the medical school.
The motorcycles are a very good means of transport in Africa currently, mainly because the lack of paved roads, but you have to maintain them well. When I came across the Writers for Health organization, I found that this is one very powerful example where they were exactly using a transport management solution, preventive maintenance, how to do inventory control, applied to the right target population to make a difference. The control districts that were not using these methods of maintenance and provision of spare parts, vehicles died. Under the districts where riders was managing the vehicles, zero death of the motorcycle.
What the research has shown is that systematic management of transportation works. There was a 3-fold increase in motorcycle trips to provide basic health care, a 4-fold increase in the reach to distant villages, and a 5-fold increase in the number of patients seen by the healthcare workers using the transportation.
We can get rid of malaria, we can get rid of diarrhea, we can get rid of cholera. Those are things that have solutions, have answers. This puts the transportation problem at the center of the stage as part of any solution.
There are investors who are already interested in transportation for health ministries. They typically donate vehicles or motorcycles in fleets, sometimes small, sometimes big. But I think that what the call to action really should be is to couple that donation with systematic transport management to make sure that the assets that they give stay running.
A solution to a big problem doesn't have to be a big solution. Simple technology can also save lives.